Hey guys, this is a VSG video, and what I will be talking about today is labs and how I'm feeling and where I am in my VSG journey. So, first things first, I went and got some lab work done finally. I visit my PCP, and when I went in for the visit, she and I both noticed that I was off in my head. Okay. I couldn't answer certain questions, I couldn't remember things. A few days before I visit my healthcare provider, I fell, just feeling lightheaded, can't think. It was just a rough time for me. So her first thoughts was, you may have a urinary tract infection. I said, oh, I had one of those a couple of months ago, and yeah, I was feeling kind of weird. So she did a urine test, and it came back that I had blood in my traces of blood in my urine, um, ketones, and something else she mentioned. See, I'm having that brain fog. It was something else. I'll remember as I continue. So she asked me if I had any issues with my kidneys in the past. And my response was, I remember being told I had a cyst on my kidneys, but other than that, So she says, I'm going to run some labs. I'm going to check your A1C, see how you doing. My labs came in yesterday, and as far as my iron is good, I'm not vitamin deficient. My B12 is normal. All of the things, that we need to be mindful of after weight loss surgery. So I'm good in that area. My A1C was out of range. My complete blood count with differential was abnormal or high. And my lipid serum panel, that was elevated. My cholesterol elevated, and maybe the try something, whatever, I don't remember, that was elevated too. So, guys, I am pissed. I'm not dealing with this too well, because the highest that I've been recorded on paper was 313 pounds. I didn't have all this going on. My dog. I did not have all this going on. Now that I'm 90 pounds down, now you telling me I'm diabetic? Now they give you a range of 5.7 to 6.4 to consider you diabetic. My number is 5.9. So to you all, you may say, oh, girl, quit tripping. You are pre-diabetic. No, you stop tripping. There is no in between, and don't let them tell you that. I am displaying every sign of diabetic. The foam in my urine, the excessive thirst, fatigue, the brain fog, wanting to eat. It's like I was feeling like this before the surgery when I was heavy. I was too big. So of course I was tired and things is hurting and just felt lousy. Yes, I did. But as the weight started coming off, I was energetic. Boom, 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 boom. Could not sit down. I'm ready to go. I'm ready to go. I'm ready to go. What's next? What's up? Where you going? You got your shoes on? Can I go? I was so full of energy and so full of life. And then just one day I got knocked off my feet. I couldn't move. I went back to where I was when I was 300 pounds. And I noticed that and I'm like, what? So it wasn't me being heavy after all. I'm just internally sick. Then I started noticing the little foamies in my urine. Then I'm testing it to see if it's sticky. Mind you, I am a healthcare provider, so I know what to look for. And on top of that, I worked in um, a dialysis clinic for over 10 years. So I know, okay? And I'm drinking a lot of water, but I see my urine at times will look a little golden, noticing that I'm drinking hella water while I'm not going to the restroom. Then I'm looking at my stool. For some reason, my stool was like 2, 3, 4 times a day. Yes. And I was talking in my past videos how it was hard for me to move. Then I'm looking at the color of my stool, which is not a normal color. All of this is tying in with my lab results. Now I'm able to see what was happening, what's going on. Okay. Um Tomorrow I go back to my doctor, and I'm not saying that I want to start medication, but I need medication because of the way that I feel. I don't want to feel like this. Help me to help myself feel better and to get back on my feet. Okay? And I know now, like my doctor, my surgeon was telling me, lay off the beef and the pork. That was the bariatric surgeon. Chicken, fish, and turkey. Doing my own research, that pork and that beef is not what you need. That's a treat. But if you can come up off of it, come up off of it. I'm up here thinking, oh, I can have butter with my shrimp and sour cream and all this stuff because I'm not eating carbs like that. No, cholesterol off the chain. But my thing is, don't the weight loss surgery supposed to help with this? People who were diabetic, no longer diabetic. People with high blood pressure no longer have high blood pressure. I mean, it just seems like it's the total opposite for me. The stuff that I didn't have when I was fat, obese, morbid, 90 pounds later, this is what's happening. I did all of that to avoid stuff like this. Sleep apnea, people coming off their sleep apnea machine. I need my sleep apnea machine more so now than I did when I was 313 pounds. I'm just in reverse. Why am I going backwards in my health and not forward? I'm not expecting for you all to answer that, but these are questions that I will be asking my doctors. Okay? Um, I feel like crap. I am 7 months post-op. When I was 1, 2, 3, 4 months out of my surgery, I couldn't wait to see what I looked like when January, February came. I was anticipating because I knew I was going to be snatched. I knew I was going to be skinny. No, I'm not. I am just as big and fat. You know, is not what you think, and oftentimes it's not what you expect. You expect to be healthier, you expect to be leaner, and it doesn't go like that for everyone. And I'm going to call it false expectations. As I said in my earlier videos, your surgical team, your bariatric team, will not do this for you. You must do it on your own. Psychiatric evaluation, counseling, and the fullness thereof. We have an issue, and our issue is overeating. One. But we need to get down to why we fell into that addiction. What caused it? And get down to that, because psychologically I'm not where I need to be with this. 1 minute I'm okay with it, 1 minute I'm not okay with it. And yes, I did make me an appointment to see Centerstone. If anyone is familiar with Centerstone. And I'm going in there for anxiety and depression. I'm not asking to be medicated, just counseled. I don't, that's what I'm expecting. And it's okay with it, because black people, we think we don't need it. We think mental illness is only in the white community. No, it's in the black community too. Make no mistake about it. We just not familiar with it. We see it, but we don't know what to call it. We don't know how to diagnose it. It's, oh, they just tripping. They'll be all right. Give them a drink. Give them a blunt. Give them something to eat. Give them a hug. They'll be all right. No. We need to talk to someone and see someone as well. Okay? So, I don't see my surgeon back until, I think July 4th. I will be a year out then. I was able to come up off that 224. I made it down to 220. I don't know where I am now. I'm here to say I didn't gave up on it. I'm not looking to lose any more weight. Right now, my concern is to get my levels down. And if that's by the way of dieting, exercising, drinking more water, and in doing those things, and the side effect is losing weight, then so be it. But my primary goal is not, oh, I need to lose weight. I need to do what I need to do so my lab numbers can be normal, can be in the range. You know, I'm telling you the truth. My story is not everyone's story, but there is someone out here that can relate or may even experience what I'm experiencing. We worrying about the wrong thing. We worrying about our hair. We worrying about our nails. We worrying about our skin. And I'm not saying that you don't have to be concerned about that, but pay attention to what's going on the inside. Less on the outside, but more on the inside. Make sure your numbers is good. Make sure everything is in range. Continue to take your vitamins. Hair loss, skin, that will work itself out on its own. Internally, will not work itself out on its own. Okay? That's what I have for you all today. And I will be back later to give you all an update on my blood work and if I need to be medicated for diabetes.